You mentioned earlier, Dr. Ritchie, low intensity therapy. Could you tell us about the types of treatment options?
So I'll go high intensity therapy or intense chemotherapy always has to be given really in a hospital. And it always, if you don't start it in a hospital, if you can start certain intensive chemotherapies like Vyxeos, which is also intensive in the outpatient setting, but by day 7 or 8, you end up in the hospital. And intensive chemotherapies, you lose your hair, there's GI toxicities, you're at high risk of developing infections, and you need a lot of transfusion. And for even young people, it's a difficult therapy for which you're in the hospital, and 90% of patients are on IV antibiotics. So it's intensive chemotherapy because it has to be given in a hospital setting and requires intensive supportive care. Low intensity therapy can be given in the outpatient setting. So at the present time, you can get a drug like azacitidine, for example, which is an injection that you get 7 days in a row. Unfortunately, you have to come to the doctor's office every day for those injections. But once you've had the injection, you can go home. Right. Combined with venetoclax, which is an oral agent. So an oral agent can be given at home. You need close supervision in the physician's office when you're on this type of therapy, but you don't need the constant support that you need if you are getting intensive chemotherapy. So it can be done in the comfort, really, of your home and with your family. You will have to come in and have transfusions, potentially, as an outpatient. Nearly everyone does. And there's always the risk that you develop a fever. And if you do, you have to come into the hospital for IV antibiotics. But in general, low intensity means not so much support needed in a hospitalized setting and the tolerability of this particular chemotherapy in the outpatient setting.